Can you provide a brief introduction of yourself and what you do?
Sure. So my name's Jo Becerra. I have been a genetic counselor for about 12 years. I currently work in a laboratory helping other genetic counselors and physicians choose genetic testing for their patients.
Awesome. Really briefly or as much detail as you would like, why did you decide to go into the medical field, genetics, or decide to do what you do?
Sure. So I discovered genetics in college and really loved it, but found out really quickly that I wasn't very good at lab work. I just, I don't have that kind of skill. And I also really wanted to educate people and interact with people on a daily basis. And I ended up hearing about genetic counseling, and most genetic counseling is a counselor speaks one-on-one with patients about their situation and their options about genetic testing. They help them make decisions about if they want to go forward with genetic testing or not. And so it just really sounded like a great way to combine science with humanity, right? Getting to interact with people on a daily basis, but still stay in the scientific field and learn more and more about genetics.
That was really deep. Wow. So you said you decided in college to do what you wanted to do. You didn't decide to do this in high school, so you decided in college. What were you planning to do before?
Yeah, so I actually didn't know that genetic counseling existed when I was in high school. And it was quite a long time ago at this point. So when I graduated from high school, I didn't know what I wanted to do. And so I decided to go to a community college. And it was while I was there that I ended up picking up a book about genetics and fell in love with it. I started bugging all my friends about all these genetic facts and talking their ear off about it. And that's when I ended up finding out about genetic counseling and decided to go into that. Really glad that I didn't just choose something that I wasn't sure about and just dive straight into that. And I took my time to figure out where I wanted to end up.
So it's interesting that you mentioned that, because the reason we do this club is obviously we go to a very STEM science-based high school, and often there's kids who plan their lives out the second they hit freshman year, and it's interesting to see kids realize oh my gosh, I have no idea what I'm doing and I don't want to do this, and you got to college and figure out what you want to do, which is just good that you mentioned. So you say you're a genetic counselor. Just in a couple sentences, what does a genetic counselor do? And just what does a genetic counselor do?
Sure. So genetic counselors have a specialized degree in genetic counseling, and we weren't very creative with that term. We are trained in genetics and in counseling. So we basically help patients and families make decisions about genetics. So either they may be faced with a decision as to whether or not to get a certain genetic test, and they might be faced with decisions about what kind of treatments to accept based on the results of those genetic tests. So we help walk families through those decisions. So that's basically it in a nutshell. We can work in prenatal settings where we're working with pregnant women, dealing with things going on in their pregnancy. We can work with families who have genetic predispositions to cancer. So maybe lots of people in the family got cancer at very young ages or got very rare cancers, but we're popping up in all sorts of different areas of medicine. So in neurology, there's renal genetics, there's every specialty we're starting to get into those as well.
So could you give an example of how would you handle on a day-to-day basis if someone comes in and you have a patient or a client? How would that work? What is your job in that situation?
Sure, sure. So let's say, so before I came to the laboratory, I worked in a mostly prenatal clinic. So we would have a woman who would be referred to us by her doctor because the doctor saw something on the ultrasound that they thought might be concerning. So then when they came to our clinic, they would have a very detailed ultrasound to kind of evaluate kind of more in depth of what's going on with the baby. Based on that, they'd talk to me about what kind of genetic testing options might be available if we think that the cause of the condition might be genetic. And then at that point, I would lay out, these are the options that you have. You can decide option A, option B, or do nothing, and kind of go through the benefits and the downsides of each of those choices. And then if once they've decided, okay, I'm going to go with option B, I'd help coordinate all of that testing getting done. And then once we have the results, I would spend the time with the patient to make sure that they understood what the results mean and where to go from here.
So your job is more to do with the patient and working with the patient one-on-one to see their options instead of just working on the patient themselves in terms of like medicine related things, you know?
Exactly. So I'm not a doctor. I don't, treat anything. I don't prescribe anything. We work closely with doctors who are making diagnoses and providing treatments and those kinds of things. But when you get into genetics, it's not just about like, okay, you're diagnosed with this condition, so you take this drug. We're talking, what are the chances my kids are going to have this? What's the chances that my sister has this too? How do I talk to my child who is 5 and doesn't understand any of this? When do I start telling them about the fact that this could affect their children? So we really go through all of the kind of complicated relationships between health and genetics with the patients to make sure that they have the full picture and really can make informed decisions about their own healthcare.
So you have to maintain long-term relationships with your patients in your job, right?
There are some genetic counselors, like especially in pediatric clinics, where they'll see a patient every year. But for me, in the prenatal clinic, I'd often only see them maybe once or twice during a pregnancy. And then unless they got pregnant again, I often didn't see them. So we're not doing, long-term counseling, like grief counseling or anything like that. Our counseling is really about the moment of or surrounding their own decisions about how to move forward with things.
That's interesting because originally we were interviewing people who were involved in the field of genetics, and we found someone who was doing more lab work, and your job involves more patient work, which is just something different. So why, you kind of already touched on this, but why did you choose the career path you did, and or just in general, what interested you first in thinking like, this is what I want to do?
Sure. So yeah, like I mentioned, I really loved genetics, and I really wanted to stay in that field and still have that human connection. I think one of the things I like best about this field is that it's always changing. And so you really have to be a lifelong learner and really keep on top of the changes, because there's always new genes being discovered, new associations being discovered, new tests coming out, new technology available. So I think the fact that I was going to get to keep learning my whole life by going in this field was one of the big draws for me.
When you say keep learning, you're talking about I think in all fields of medicine that things are constantly changing and new data and new research is coming along. So would you say for all people who are pursue careers in medicine, they continuously have to evolve their ways and keep learning more depending on their patients, or just in general?
Yeah, I mean, in general, medicine is like that, right? We're always learning new things, and in science in general, right? We're just put another rover on Mars, right? Like that's we're making amazing progress as humans, right? In science in general, but with genetics, this might be my bias coming out, but we are learning more and more about how the human genome affects our health all the time. You know, in genetic counseling started around the 70s, and it was mostly just about pregnancy. And now we're in cardiology clinics, we're in kidney centers, we're getting involved in more and more fields of medicine, whereas, you know, a cardiologist might only focus on the heart for their entire career.
Mhm.
Genetic counselors we're certified in all areas of genetics, and that includes the entire body. So there's always new specialties and new fields to really dive into, and so that keeps it really fresh and engaging.
That's interesting because I know when, with my very limited knowledge, I know that some people prefer to specialize, whether that's like pediatrics, cardiology, whatever it is, in a specific field of medicine. But when you go in genetics, you have to. Are there any other fields in medicine where you have to be specialized in supposedly everything?
Yeah, so I mean, in like family practice, right, you need to
Yeah.
have a well-rounded knowledge base, so that you can identify when somebody needs to go to a specialist, right? So in all fields of medicine, you're really going to need to know kind of where the edges of your understanding are and when to refer to someone else. But as far as like other fields where we're really involved with the entire body, I think genetics does have kind of a unique spot in that regard.
Moving completely away from that. So what is Elsie? Is
Sure.
that, yeah, just go into what that is. Like introduce it and then what do you do with that?
Yeah, so Elsie is my company that helps genetic counselors obtain their genetic counseling licenses. So unlike doctors, well, now with COVID, obviously telemedicine has really had a big boom, but
Yeah.
genetic counselors have often in the past, even before COVID, used telehealth to provide services. Because if I'm talking to you about your family history of cancer, I don't need to examine you, right? I just need to talk to you and, you know, review your medical records. I don't need to put my hands on you or be in the same room. So there are a lot of genetic counselors who will see patients in other states over telehealth. And so that can get complicated as far as licensure goes, because if I'm sitting here in California, but I'm talking to somebody in Idaho, I don't just need a California license, I also need a license in Idaho as well. And
Oh, wow.
Idaho's requirements are very different than California's. So Elsie is a company that I started that helps genetic counselors get those licenses in those other states where they need them, and also helps to maintain them because they have to be renewed every year or every other year, and they need a certain number of educational units to maintain those licenses. So we have software that helps keep track of all of that. And then we also have services that help the GCs get the licenses and renew them too.
That transitions very well to the next question. So what does your day look like? And this is before or after COVID. So have you been seeing more patients out of state with this more virtual format?
Sure. So I moved away from a patient facing job about 5 years ago. So I personally don't see patients anymore. But we do have, especially through Elsie, we have a lot of clients that have really increased their use of telehealth, especially, you know, some of these larger genetic centers that have a lot of specialty clinics, you know, they may have experts that are the only ones in their field in the entire state. And so we've seen a lot of them go from having all of the patients from all these different neighboring states come to them. Now they're calling them on the phone or doing them over video, and now they need to get their licenses in those neighboring states to make sure that it's legal that they talk to them while they're still sitting at home. So yeah, there's been a huge increase in the amount of telehealth happening in the genetics community in general.
That's interesting. So would you say that COVID impacted the telehealth community at all? in what they do?
Yeah, I think it's really increased the demand a lot. I think it's also increased the amount of visibility of telehealth, because one of the big barriers before to telehealth was it still is billing, because the rules about what you can bill for if you don't have the patient sitting in front of you is different in different places. And so I think that's really shined a bright light on that at this point. And so I think that as a whole, at least the genetics community has been looking for solutions to those kinds of problems. I think we would have gotten there eventually, but I think COVID has really sped that process up and really made it more of a, like, this is something we need to address and deal with now, as opposed to, oh, in 10 years when we're doing more telehealth, we can deal with it then, kind of deal.
So do you think this, like, right now, obviously kids are deciding what they want to do, what they want to major in. Is it a viable option to consider a career in telehealth now that COVID has made it more popular?
Yeah, I mean, and a career in telehealth, I think that once COVID ends, there will be a rush back into more face-to-face kind of interactions, but I don't think telehealth is going away. I think that the gains that we've seen are probably here to stay. They may lessen a little bit. I think that it's great because it opens up the opportunity to live where you want to live, especially in genetics. There's not a whole lot of clinics around. So you usually have to be in a major city in order to find a good job in genetics. But the expansion of telehealth means that maybe, you know, you could live a little further out from the major city, especially if you're only having to commute in once in a while, something like that. So I think that the expansion of telehealth is a good thing for the patients, because they don't have to venture into a big medical center, but it's also a nice thing for the providers too.
So what would you say your day looks like? This can be like before COVID or after COVID.
Sure. So in the clinic, my days would look like I'd see maybe anywhere between 6 and 10 patients a day. That was actually a very high volume clinic where I was before. And so I would show up, and most of the time I'm talking with patients about their options, and I get to give good news at the end, saying that, you know, everything looks good or everything looks normal. But then occasionally we'll have a case where there's some sort of bump in the road, and not everything is normal. And so that could actually take up quite a bit of time. I could end up spending an hour or more with a patient who's dealing with some very difficult decisions about how to move forward in their pregnancy. Then, you know, I'm making phone calls to people to give them results over the phone. What else? I happen to speak Spanish, so I would be
Oh wow.
translating. Yeah, I would be translating for the doctors sometimes, especially if they'd find something on the ultrasound. I'd go in there and explain to them what the doctor was seeing, that kind of thing. And then you have your charts. You know, you can't get away from charts. You always have to document everything that happened in the day. So I usually end my days by making sure that all my charts were done, and any kind of, you know, we were specialists, so we have to send a letter back to the referring doctor explaining the summary of what all was happening in that patient's appointment.
So, oh, sorry. This is really random, but people are scheduling in high school right now for next year for like 10th, 11th, or 12th grade, and a lot of kids are dropping their language classes. Are you in, like, did you grow up speaking Spanish, or did you learn it out like in school?
Yeah, I learned it in school. Well, okay, so it's kind of a complicated answer. Where I grew up, it's the town, we have like 80% of the population is Latino. And so, you know, my best friend is Mexican. My husband is Mexican. I've always wanted to be able to speak Spanish growing up. So in college, I took about 4 years of Spanish. I really didn't feel like I was starting to get comfortable in it until I started working a retail job or as a cashier, and I had to speak it basically sink or swim, right? Like it was like, I have someone in front of me, they don't speak any English, I've got to use it now. And that's really where I started to feel like, okay, I can speak this. And then when I was doing my training in genetics, I would pair with a doctor or a genetic counselor that spoke Spanish so that they could help me work on it as well. I also did a lot of role playing with my husband, who is fluent, making him pretend to be a pregnant woman so that I could counsel him and practice. And then in the clinic where I worked in downtown Los Angeles, you know, we had a very large Spanish speaking population. So I really got to hone in on my skills there. And by the time, I don't know, after the first year, I was very, very seldomly using a translator for Spanish. I would for other languages, obviously, but for that one, I got to the point where I could be independent with it.
I was wondering because we interviewed someone I already mentioned before who worked in the lab, genetics lab for muscle cells. Her research involved muscle cells, and she was doing a PhD. And she said that she had an English minor, I'm pretty sure. And originally she was just planning to do it because either she wanted to teach or something else. And like she ended up with, when she was applying and writing her PhD, it came in so much handy for her. And like you said, you took a class in Spanish, and all of a sudden you're like, now that you're a genetic counselor, it seems so useful to you. So it's like, I think we think that if you're going into medicine, you have to take only what you do in college or what you do in school is only focused around that. But like from the people we've talked to, it's obvious that that's not the case at all. So
yeah, I mean, yeah. I'm a big proponent of staying engaged in the arts and language. You know, the more well-rounded you can be, it's just healthier for your brain, right? To use all sides of it. Yeah. So, I really encourage people to not just pigeonhole themselves into one thing, but keep learning about all different aspects.
Yeah, absolutely. I looked at your blog very briefly. I saw a couple posts, and I looked at them, and that's how I thought of my questions, what I was going to ask. So you talked about, I looked at a couple. I looked at the one, so you want to be a genetics counselor, a day in the life of a lab genetic counselor, and meet a genetic counselor, pediatric genetics. You can pick one of those, or like if you have another post in mind, because we link your website on our website. So like, is there any post that you want to go in more depth about? It can be one of these. It doesn't have to be though.
Sure. Well, you know, I do get a lot of DMs from students. I do have a post in there. Can't remember the exact name of it. Oh, maybe it's the So You Want to Be a Genetic Counselor one that you mentioned. Yes. Yeah. So that I've tried to put together a bunch of links to about what it's, how to become a genetic counselor. You do need a master's degree in an accredited program, at least in the US, to become a genetic counselor. So I have information about what the requirements are for that. I think I also linked to some other blogs that talk about what it's like to be a student in a genetic counseling program and those kinds of things. So that's a really good one for high school students if you're looking at like what would it take to become one. The day in the life of a lab GC. So my work in the lab is very unique, I think, compared to a lot of other lab positions. Genetic counselors are getting into the laboratory more and more. A lot of us will be involved in writing reports that the doctors will see when they order a genetic test, or involved in interpreting the genetic variants that we find, right? Because if you find a change in the DNA, and it's a new change that we haven't seen before, how can you tell if that's going to be a problem for that patient or not? You know, a lot of times we have to look at the literature, we have to look at different models predicting how that genetic change will affect the protein. There's all sorts of things that need to go into that. So a lot of genetic counselors have that kind of position in the lab because they're good at analyzing the genetic data and then translating it into a report that somebody can read, right? Because we're trained in communication and breaking things down. My position in the lab has been to help other genetic counselors and physicians choose what tests to order, because menus of genetic laboratories are growing bigger every day, and it can be really overwhelming to say, like, I have a patient with condition A, what's the best test for them to have? What's going to be the most comprehensive, the fastest, the cheapest, those kinds of considerations. So my day in a life of lab GC kind of goes over what the laboratory side looks like for me. But there are all sorts of other roles that genetic counselors are filling both in the clinic and outside of the clinic as well.
On the topic of students, so what do you recommend to students applying to college to pursue? It can be either a career in genetics or medicine or in general.
Sure. So if you know which area you want to go into, if it's genetics or something else, reaching out to professionals in that field to find shadowing opportunities is really invaluable. You can have an idea of what it might look like to become that kind of professional in your head, and then you get there and it's nothing like what you thought. Right?
Yeah.
So I personally thought I really wanted to go into pediatrics, and I ended up getting the opportunity to rotate in a pediatric clinic, and thought, this isn't exactly how I thought it was going to be. Maybe that's not for me. And not that I have anything against pediatrics, but it wasn't the vision I had in my head. So there are a lot of professionals that are willing to, have you come hang out for a day with different, obviously with COVID, that's been cut way back. And different institutions have different rules about, who can come and all of those things. But if you have the opportunity to shadow or even just do a few minutes on the phone with a professional in the field that you're interested in, I definitely say reach out and try to do that.
Yeah, Emma Hinkle, who we interviewed before, who I've mentioned many times already, she said the exact same thing. I'm noticing a pattern. Shadowing someone or doing an internship will always prove beneficial no matter what you want to do, right?
Yes, absolutely.
All right. This is just kind of an opinion question. What do you like most about what you do?
There's so many things that I like. I think just the fact that genetics stays so exciting. The changes are coming so quickly, and I think that now we're getting into a phase in genetics where we're able to apply our genetic knowledge in a way we've never been able to before. So when we first discovered the gene for X disease, that's great, we can diagnose it, but the treatments oftentimes are still years down the line. We've gotten to the point where we know enough about genetics that we're starting to be able to target the genetic changes and make treatments based off of those. So one example is spinal muscular atrophy, or SMA. That was a condition that still kills many babies in their infancy. And now we actually have 2 treatments on the market that appear to just be curative. Like, these babies that had such severe muscle problems that they couldn't move at all are now growing to 2 and 3 years old and learning to walk.
Oh, wow.
And so seeing those kinds of changes in the field, where we're not only just understanding the genetics, but actually being able to make treatments to fix those things and make a lethal diagnosis no longer a lethal diagnosis, is just so incredible to me. So I think this is a really exciting time in our field to see more and more of those treatments come out, based off of the years of work that we've done in the past.
You just made your job sound very exciting and everything, but it's possible that you like everything about your job. But is there anything that you don't like? That was a very good answer to the other question. But is there anything that you don't like about your job?
Yeah, I mean, yeah, with the good, there's always bad, right? There's always challenges. Part of what makes, when I look back and think about the patients where I made the biggest impact, I made the biggest impact because they were going through the hardest times, right? You know, they had a baby that wasn't going to make it, or, you know, they had a family member with one of those lethal conditions that I was talking about. That can be so emotionally draining to go through with this family, right? You feel for them, you can sometimes feel helpless because we don't have those treatments yet that their family needs. So supporting them through those times can be extremely emotionally exhausting, but it can also end up being super rewarding as well. So when you get a lot of those types of cases back to back, and I used to always say, you know, these come in threes, because we'd end up having 3 families or 3 couples with this exact same diagnosis come in around the same time, that can be really emotionally draining. And you know, my husband at some point has told me, like, you can't talk to me about work. It's just too hard. Right? Like, I can't hear about those terrible things anymore. Like, you have to keep it to yourself. So that can be really difficult to kind of feel that kind of emotional weight on your shoulders. But we deal with it by having really close genetic counselor friends who you can talk to about all of these crazy things that you're seeing and tough cases that you've had, and kind of lean on each other for that kind of support, as you really do need it sometimes.
So obviously, as someone who works with patients so heavily, how do you deal with that emotional aspect? Obviously, you kind of already touched on, it, but how do you deal with that emotional aspect of your job
Yeah.
and delivering news to patients?
Right. So yeah, delivering news to patients can be, you know, a very difficult thing to do. We're actually trained on how to do that in our programs. So it's not something that you're just kind of thrown out there and said, like, go do this really, really hard thing. But, you know, it is always hard when you are giving someone news that they don't want.
Mhm.
So I think, like I said, leaning on other people in the field that understand what you're going through and being able to kind of debrief with them, whether it's a physician in your practice or another genetic counselor or a friend that understands these kinds of things, and then just being self-aware of when you need a break, and taking that time to kind of do that self-care. I also really try to leave work at work. It can be really hard sometimes, but trying to kind of make that distinction between work time, I'm thinking about work things, and then home time, I'm thinking about home things, can be important too.
That's interesting because I like my brother. He is doing biomedical engineering, and he hasn't applied to medical school yet, but he's doing internships right now in college. And there's days I think he was only doing it once a week. He would go to the hospital and work for like 6 hours or something like that, and he would come home. And it's like obviously he can't talk about a lot of stuff, but he just seemed as an intern. They also like he has to do the dirty work. It's not like
Yeah.
diagnosing and anything. So he'd come home so drained and like I had this person to work with and he'd have to like talk to my mom about it because it's just sometimes it can be a lot.
Yeah.
And like in my head I'm like, stop being a wuss, like get over yourself, you know what I mean? But like as with someone having to work and see people in pain because no one goes to the doctor because they're doing okay,
Right.
like and having to see that every day, it must like obviously makes you stronger, but it's you do you ever get used to it or is it just something you deal with?
Yeah, I think that, you know, you end up kind of compartmentalizing some things. I know me and one of my friends have a very dark sense of humor that we probably shouldn't share with other people because they might be horrified, but it's a coping mechanism for us, right? So there are things that, you know, you just kind of, that becomes part of life and you just deal with it. So, but there is a problem of counselor burnout where you've just gotten to the point where it's too much and you really need to find ways to step back and recharge when that kind of thing happens.
Uh, Completely moving away from that.
Sure.
Um, can you go in depth about like your school journey, like what you did in college, what classes you took, what you majored in, and how long did it take? Just all about how you had to prepare before you started your career.
Sure. So like I mentioned before, I started at a community college, which did not make my principal very happy, honestly. I was the valedictorian of my high school, and he didn't like
Oh,
that
wow.
the valedictorian was not going to a four-year university. But I didn't care because I wanted to start out my journey kind of more slowly and not commit to a four-year college if I didn't know that what I wanted to major in was going to be there. So I did discover genetic counseling while I was in junior college. And so I ended up transferring to UCLA, and I was a microbiology, immunology, and molecular genetics major. They really like to make the major names really long and impressive sounding over there. So I learned all about the molecular part of biology. I also took some psychology classes while I was there because I knew as a genetic counselor they were going to require those of me. I also did some volunteer work, which genetic counseling programs really like to see. And GC programs usually want you to have some sort of either crisis counseling or some sort of experience where you're interacting with people in crisis. So I had actually volunteered at UCLA at one of their satellite clinics, and they had it was basically providing resources for either low income or homeless patients. So we would sit in the waiting room and in this free clinic, and we had a bunch of books out on the table of all these different resources, and people would come up to us and say, hey, I need a dentist. And so we would go through all the books and find dental clinics that were either free or reduced price for those patients, and photocopy that information for them. This was before everyone had smartphones in their pockets. So I don't know what that would look like today, but interacting with people that are in need and maybe having a crisis that they can't pay for right now. So there are a lot of genetic counselors that either do like suicide hotline volunteer work or that kind of thing to try to work with people in crisis or in bad spots at that point. So I did that. What else did I do? I had to take statistics because all of my calculus didn't count towards the statistics requirements of my program that I wanted to get into. So I actually went back to a community college over the summer to do that. And then I ended up going to a genetic counseling program in Los Angeles at California State University, Northridge, which unfortunately no longer exists. But I went there for 2 years. During that program and all genetic counseling programs, we have classes as well as basically internships. We have our clinical rotations. So we ended up going to different medical centers around Los Angeles for a semester at a time and working with real genetic counselors in real clinics with real patients, learning how to do the different aspects of their job. And so by the end of the 2 years, I was able to independently go through an entire session with a real genetic counselor by my side, supervising the whole thing. But so it really prepares you for being put out in the real world in a real job by the time you graduate.
So I would ask you another question, and that was a really good answer, so thank you for that. But we are students, so we have a 40-minute Zoom time, I'm pretty sure.
Okay.
So, yeah. One last thing, just to sum everything up. What is your advice to students pursuing your career specifically, or just medicine in general? What would you recommend, and what should people keep in mind?
Sure. So like I said before, shadowing opportunities. Now with social media, there's so much more information out there than there was when I was trying to find out about this field. So following genetic counseling programs on Instagram or Twitter, there's a hashtag GC chat where a lot of genetic counselors will post things about the field, or even just silly things like pictures of our pets, stuff like that. So follow as many people as you can on social to try and get more information. The more you can learn about your field before you get all the way down that commitment of becoming that field or that professional is just going to be better in the long run. So you can see really if you like it or not, or if that's something you can really devote your life to.
That was really deep as well. Thank you so much.
Sure, no problem.
Interview with us.